and gentlemen, this is our penultimate session. I began by saying today is our grand finale day here on the M42 main stage at the inaugural Abu Dhabi Global Healthcare Week, and it has lived up to all the expectations. We'd had a fantastic cast of thousands, I feel, that have graced our stage, and we continue with a thought-provoking final panel discussion of day 3 here. We are looking at tech-enabled medical travel. So this is super applicable to so many people. To take us through this, may I please welcome back on stage Dr. Fatma Redden, who is a Senior VP Clinical Development at M42. Dr. Fatima, please grab your mic. Have you enjoyed 3 full days?
Let's ask our audience, did you enjoy it? Thank you for staying late with us. Thank you so much.
And of course, we're broadcasting around the world because we have our audience watching online as well. So for this very final panel discussion, which is our penultimate session of the day, we of course have a wonderful cast list. Join me in inviting them on stage. I have Evgenia Kafusi, who's the Operations Director at Book Dialysis. And there is a very keen interest in book dialysis, so we're going to ensure that you get a spotlight on this particular session. And then we have Samia
We
Dukhali.
have Dr. Samia Dukhali, the lead of Global Patient Service at M42. Welcome on board, Dr. Samia.
Robert Adam Griffiths, who is a Senior Director of Clinical Operations at Imperial College London Diabetes Centre. Welcome, Adam. And Philippe Almeida, who is Diavram's holiday dialysis ambassador and digital content creator, and the first patient who's come through book dialysis to Abu Dhabi. That is Philippe Almeida, and he completes our cast list for this very final panel discussion. Dr. Fatima.
Thank you so much, Amandip. I'm one more time very happy, excited, honored to have all of you. And this is really a global panel that we are having. Evgenia, I think you came from Greece. And Philippe, I think from Portugal. That's amazing. Welcome on board, and please grab your mic. For the last 2 days and a half, this is the 3rd day in this conference, our main focus was technology, AI, how this innovation is optimizing the patient care, how are we optimizing the access to care. And today is really, this panel is showing a real application of AI and technology within chronic disease, chronic kidney disease, and with dialysis patients. I'm very honored to have Book Dialysis with us. Eugenia, tell us a little about Book Dialysis, please.
Good evening. I'm delighted to be part of this panel discussion today.
Happy to have you on board. Keep your mic close, please.
Yes, thank you. So, Book Dialysis is the world's leading independent digital platform with a higher purpose: to free chronic kidney disease patients and their families to move with confidence around the world.
Amazing.
Yes.
And since when are you on board?
Well,
years?
2017.
Oh, that's amazing.
Yes.
And where are you based?
We're based in Sweden.
Okay. With several hospitals globally that you are serving?
Well, today we bring together a global network of over 830 clinics in 50 countries in 4 continents.
Wow, a big applause, please. 870 countries on board. Thank you so much.
Thank you.
Then please, let's go technical and let's dig deep and let's understand how the book dialysis is using technology to enable the medical tourism. Kindly.
So, actually, currently, about 10% of the global population is suffering from chronic kidney disease. And about 4 million people require dialysis treatments 3 times per week, 4 hours per session. So you can imagine that traveling for dialysis patients can be complex, worrying, and maybe a distant reality, since they need to ensure they will have the dialysis treatments throughout their trip far away from their clinic that they are already using. So actually, That's where we, as book dialysis, come in to make a difference. And book dialysis is actually a user-friendly environment where patients can use to book their dialysis treatments in 3 simple steps and with real-time treatment availability. Our booking engine is an intuitive, dynamic, state-of-the-art platform which is available in 9 languages. Hence, we're able to reach more than half of the world's population in their native language.
That's amazing.
Yes, and speaking about technology, we have recently launched our own mobile booking application to better serve chronic kidney disease community. Our dedicated customer support team is also available to assist users and provide personalized and human-centric experiences.
Thank you so much.
Yes.
That's great. Tell me more.
Of course. So actually, book dialysis isn't just about convenience. It's about empowerment through technology. It's about giving chronic kidney disease community the tools they need to reclaim their freedom, to explore new worlds, and to live lives on their own terms.
Looks interesting. Then let's ask Philip. Okay. Philip, welcome on board. Welcome to UAE.
Thank you. Thank you so much.
Thank you.
Hello, all.
Philip is coming from Portugal.
Yes.
Yeah. He is a global patient. He visited how many countries?
More 40. In dialysis, 39 countries.
Very nice.
Yeah.
In fact, Philip is Diaverum Holiday Dialysis Ambassador and digital content creator. You have a book, I think, yeah?
Yes,
Okay.
book. Because in 2019, me and my wife and just one child, we start this big project, travel around the world with dialysis.
Okay. So then in these last years, okay, you were traveling to a lot of countries, but in the same time, okay, you were able to have your dialysis in each country you traveled.
Yeah.
Yeah? Tell me more how it's working and how this is really important for you as a patient.
It's very important, and we are here because the book dialysis. Because when I start dialysis 7 years ago, it's very difficult to find a clinic. It's very difficult to try keep a contact with a hospital or a clinic in the other country. And when I start dialysis, a lot of people are afraid to travel because a different country, a different nurse, a different clinic. So it's just a small part of patients travel. So always my life, I love travel.
That's good.
And I want to show to my kids a different cultures, a different place. So the dialysis, it's just a part of my life. So I just start thinking, wow, I need to continue travel. And a few years with the book dialysis, it's more easy to book your treatment, and you feel safety to go I think any country, almost any country. But I want the patients feel safety to do it dialysis around the world.
That's amazing. What are the 3 countries you visited?
A lot of countries. Now I need to go to Australia and New Zealand
Okay.
because it's my last continent. But the 4 continents, Europe, America, North and South, Africa and Asia, I've been there.
That's amazing. That's so good. Let me ask you, your book in which language? Do you have the 9 languages that book dialysis are having?
Initial, it's in English, but now you have a Portuguese, so it's very easy to use the platform because it's a Portuguese language.
Okay.
I send the requests, and yeah, all people speak English, so
That's good.
it's very good to do it.
Very good. But what about your book? You told me that you booked, I mean, you have a book about traveling with dialysis. In which language is your book?
In Portuguese.
Then there is only AI application. How can we have this book in English, in Arabic, in 9 languages, please?
Please, in our book we're talking about these travels, and we start in 2009, so 19. So yeah, please, let's do it
Okay.
happen.
Looks like a project, guys. Then all the healthcare and the healthcare vision and spirit is about patient-centered care. But I'm happy that you are one of the ambassador, okay, of the dialysis and book dialysis and this technology and AI. Thank you, Philip, for being with us today. Thank you. Then let's say as you are in Abu Dhabi, that most probably book dialysis needed to book with a provider who is in Abu Dhabi. Yes?
Yes.
So where are you having your dialysis in Abu Dhabi?
This morning I have the
Oh,
Alice.
really?
Here.
Where
Yes.
exactly?
In Imperial College, London, Diabetic Center.
That's amazing.
So I start 7 o'clock. Someone pick up me in a hotel, transportation to the clinic,
Okay.
do it the treatment, and I'm here now.
Very good. Any area of improvement? Challenge them. What do you want to tell them? You have the director of clinical operation, the senior director of
No.
clinical operation, Adam.
A lot of countries now start easy process, but always I felt we need continue broken the bureaucratic stuff, because, for example, in my clinic sometimes when I ask for report, a medical report, take 2-3 weeks. So sometimes I need more quickly, you know, because I want to travel to the country, or I saw a nice promotion, a flight, nice promotion. So it's like, if I want to book this flight, but I don't have the Alice, what's happened now? So the bureaucratic stuff, we need take a better
To improve
But,
it.
yes,
Oh.
but yeah, always we have someone to the other side and answer, and you can keep the program and do it dialysis.
Thank you so much for your advice. We take this in consideration. And then let's see then with Adam. Adam, then Philip, I guess, is your first patient, medical tourism first patient, yes?
Yeah, we're very proud. Yes, he is. He's the very first patient to receive international dialysis from us.
That's amazing. Then first of all, I want to congratulate you and congratulate M42 and ACLDC for the licensing for the home dialysis. Congratulations. This was an amazing effort. Tell us a little about it and tell us about your medical tourism experience and international dialysis.
Okay, so let me take you back maybe 5 or 10 years where I ran a very big dialysis unit, and I had a team of 4, 5, 6 team members who it took to provide international dialysis for a very small amount of patients. And it took anywhere up to a month to organise exactly what you just said, that can be done, I think, in around 7 to 8 minutes now on book dialysis. So, as Hassan would say to us all of the time, our managing director, CEO, we need to consciously disrupt healthcare and the way in which it's done. So, and I'm very conscious and trying to help to deliver that. So, part of that was working with book dialysis and make sure that we can deliver what we can deliver to patients. But it's twofold. It's the other way around. How do I make sure that my patients leaving the Abu Dhabi and going to other parts of the world receive the same treatment, the same level of care, the same cleanliness, so the same I can offer for that group of patients. So it's a two-way fold for me. Beyond that, then, obviously, we want to continue to build on this. We want to continue to build on this internationally, working with international partners, international patients, and continue to build that methodology of disrupting chronic disease and making it more, how do we help you live with it easier and make it easier for you to travel the world and get to the final 2 continents, maybe in the final countries. So
That's amazing. You think that we cared about him? That's fine today?
I mean, I'm very proud of what we've done today. It's the first step. I've
Very
had very
good.
positive feedback.
And
but
he's a smiling
he
patient.
is smiling, yeah.
That's great.
Yeah. It's great. I mean, home dialysis is the next step forward, isn't it? Why can we not be in the patient's home or bring the patient's care closer to home? So let's not invite them to drive hundreds of kilometres in some cases to Abu Dhabi multiple times a week. Let's go, let's be in their home, let's be sat in their living room, in their bedroom, and help them to deliver that. So that's the next big step internally, and it kind of works collaboratively with companies like Book Dialysis, because those patients, once they know we can do it that simply, why can't they then travel across Asia, across the world, to receive that same level of care? So.
How excited are you about the announcement of M42 Advisory Board with the CEO of the Biointelligence, the remote control button on board?
It's incredible. let's not just think about patients across the city. So I can see what you're doing in Al Raha, or I can see what you're doing in other parts of the city. I can literally watch those patients and monitor them from across the world with the team of physicians and everyone behind it. So it's an incredible step forward, and it's again, as I said yesterday, it's one of those moments in time that we'll look back and think, look at the change we made. How did we disrupt healthcare and make such a difference going forward? So.
That's amazing. Then this is the first step in medical tourism, yeah? Then let me go to Dr. Semia, because Dr. Semia put it a lot of steps, but she chosen to go through the right way, I think. Dr. Semia, first of all, I want to introduce you as the lead M42 Global Patient Services. Second, I would like to congratulate you for the achievement of the Global Healthcare Accreditation GHA certification for excellence in medical travel patient experience. Please, can you applaud? This is an achievement. That's the first time that it's happening in GCC. Dr. Semia, tell us a little about it. And can you please answer to Philip when he's speaking about timing? Can you please answer to Evelina when she's speaking about technology and all these steps? Can you please answer to Adam as well when he speaks about we're trying to put these steps? What are the standards, the policies that you needed to go through when you were tackling your licensing?
Thank you very much, Dr. Fatma, and good afternoon, everyone. Yes, it is a big achievement for all of us, for M42. It is a testament to our commitment for quality care and patient safety. We are now aligned with, we've always been, but it's a validation that we are aligned with the international and renowned healthcare organizations in the world in terms of standards and processes. And talking about that, and to answer to Felipe and Adam and Virginia, we, as enablers of medical travel, we've encountered a lot of challenges in terms of the variations of standards and processes around the world. That was very challenging. And, a patient seeking treatments overseas and navigating an unfamiliar healthcare system can be daunting. So I'll share with you some of the challenges, the key challenges that we've faced, and how we as M42 successfully addressed those challenges. So we can talk first about lack of trust. This is extremely important because patients need reassurance before they travel to any country in the world to be treated and for making any decision. At M42, what we've done, we have the best accreditation, international accreditation, such as JCI, Joint Commission International, College of American Pathologists, the CAP, and that is on par with renowned healthcare organizations. The second challenge is the language barrier and cultural sensitivity, and that could lead very often to misunderstanding, confusion about diagnosis, about the treatment plan for the patients. And so what have we done at M42? We've done a couple of things to address those issues. First of all, we connected with an international organizations that provide interpreters 24 hours, 7 days a week in all spoken languages in the world. We also have in-house interpreter, qualified medical interpreter that are embedded in the patient's journey. The other thing is that M42 is a global company, so all caregivers have to have that global mindset, and this is done through the mandatory cultural sensitivity training that all caregivers through M42 network have to go through. And that's very important for the caregivers to understand the culture nuances. The last challenge, one of the key challenges, is navigating the healthcare ecosystem, and it's already complex to navigate your own healthcare system at home, let alone when you have to navigate it when you are overseas. So at M42, so we've put in place patient care ambassadors that handhold patients through their journey and helping them from the moment they pick up the call and inquire, or when they submit a request through Book Dialysis, it comes through the immediately to the IPS or International Patient Services team, who immediately pick up the call and takes care of the patient all the way to his journey, from pre-arrival all the way to going back home, and also after that. So all this was, you know, and we've gone through a rigorous exercise with the GHA, and that validated and reinforced the standard and the processes that we've put in place, because we wanted to cater for global patients.
Thank you, Dr. Samia. And allow me to take the opportunity to send a kudos to my friend Yinka, who is the VP of the Access, for this achievement. This was amazing.
Yes.
Thank you so much. Let's come back to you, my friends. We need some recommendation from Book Dialysis. I'm sure that you have a lot of advices to give as recommendation when it's coming to processes, international processes, to some of the consent, for example, of Philip, that you had the experience, okay, during these last years. But can you give us few recommendation, maybe? We'll come back for another session, I'm sure. Please.
Well, thank you, of course. So having the opportunity to accommodate patients' requests from over 100 countries, we would recommend clinical providers to actually approach their patients on a holistic way by providing multilingual and expedited support. So we do know that medical providers are acting as an extended family member, and they play a crucial role in their patients' lives. So they can actually make their dreams come true by supporting them with the arrangements of the travel dialysis requests.
That's really great. Thank you so much for your recommendation. Are you having a book? Not yet?
Sorry?
Are you writing a book or not yet?
Not yet.
Okay. Maybe he can help you.
Felipe can help me, definitely.
Absolutely.
Yes.
I come back to you, Philip. Okay. You're in Abu Dhabi. What do you want to say to our audience, okay, for us? You're a patient, a global patient. You traveled, you visited a lot of countries. You have a chronic condition who is a dialysis. For the last 3 days, we are speaking about how AI technology is enabling is you and all the patient. How can we support you? What's the advice? What do you want to hear from us?
First of all, I think, and always I said this, if anybody want to travel, it's the first trip, try inside the country, okay? Because I told you, it's a lot of people have afraid change the clinic inside the country.
Sure.
So, if you want to travel, this is my advice. Try different clinic inside your country. After this, try to the country closer, because I understand if happens something, I want to be closer to my original country. After this, we have a whole world to
Come to Abu
explore,
Dhabi.
and so Abu Dhabi, a lot of countries. So the first advice, of course, talking with the doctors about your condition. You know, it's like if safety or not safety, but always I want, and this is my future hope in the future. It's the people travel a lot, feel safety, and because the freedom when you travel, it's amazing.
Oh, we can feel it. Welcome to Abu Dhabi again. Any question to our team, please? Then an applause, please, to our panels. Thank you so much. Thank you. Thank you, Adam. Thank you, Philip. Thank you, Dr. Sevilla. Let's have a photo all together, please.
Dr. Fatima, thank you so much for expertly leading this. May we please get a photograph of everybody on stage? And as this is our penultimate session and our very final panel discussion, I'm also going to join you on stage very quickly for a photograph and say thank you so much, so inspiring. Ladies and gentlemen, join us in 2 minutes' time for our very final session. Thank you so much once again.